They are heroes and so much more. Each and every healthcare professional in Angelina County is not just a hero, but a superhero to those of us who need their strength, their expertise, their skill, their dedication, and their compassion. And they offer that and so much more to thousands of our community who suffered the effects of the coronavirus despite the dangers it posed every single day.
People were getting discharged from the hospital and then a week later dying, and so that's unusual. That doesn't happen very often because the way it affects the body afterwards, from the blood clots and strokes and heart attacks that it causes sometimes after the infection.
Watching so many become ill with the virus, struggle to breathe, and then overcome and go home to their families, while others' struggle ended in a different homecoming. It is difficult to understand how the virus impacted some patients much more critically than it had others. So many have died, but thousands more in our community have survived coronavirus because of our community's healthcare heroes, EMTs at the City of Lufkin, and nurses at St. Luke's Health-Memorial, Woodland Heights Medical Center, and the Angelina County and City's Health District. Each organization selected a person to represent their amazing staff as recipients of the 2020 Golden Anvil Award, which is dedicated to all the amazing healthcare providers in our community who continue to go way above the call of duty to care for our friends and neighbors as we enter the second year of the pandemic.
We've been monitoring COVID even before it hit the United States. So this wasn't something new for us. This is something that we do on a regular basis. So our team started preparing in advance, and then once we had our first COVID positive test here in our county, our administrator rallied our hospital partners, our emergency partners. We started having meetings, and then we did just a social media blitz on social distancing and masking up and the importance of wearing the mask and exactly what COVID was.
Each discussed the struggles with how quickly the virus changes lives, not only for patients and their families, but also their own.
At first, we're just dealing with numbers and results and not being able to actually put a face to it. And then as there was an increase and a spike in COVID positives that were, hitting our long-term care facilities, we were getting these demographics that actually had the residents' pictures attached. And so it was finally putting a face with a test result. And then we were finding out that they had been shipped to, one of our local hospitals. And then a few days later, we were receiving discharge summaries that they had passed from COVID. And that was really hard to get those test results in and then have to match it and then close out their case.
A year ago, our heroes were learning how to medically care for patients who had the virus no one knew how to treat or how and why it affected almost every patient in a different way. Still, they continued to battle for every patient every day.
We get to work every day, and there for a while it was every day. It was like, okay, we're going to be able to do this 12 hours at a time. Sorry. So we do it 12 hours at a time some days.
And that battle to save the friends and neighbors extended into one of personal survival and self-preservation.
So one of the worst days is having the patient that you've worked with and they start showing improvement, and then they just decline so quickly and that you lose them. Any of the ones that you lose, it's hard.
In the early months, many of the patients arrived at the hospitals by ambulance, and it is those heroes on wheels who arrived at every emergency, not knowing if they were going to be face-to-face with someone who had the virus. Chief Moody watched the coronavirus pandemic unfold from the beginning and took an active role as part of the solution when he and his family became two of the initial test subjects for the vaccine.
I've had nothing out of the ordinary, no signs and symptoms of any immune system that's the most serious problem with a vaccine, is actually kicking your immune system into overdrive. And so I had no signs and symptoms of an anaphylactic reaction or anything like that. And I am a person who has had a very serious reaction to medication, so I'm prone to that, but I had no issues with it.
Before COVID-19 was on anyone's radar, Moody was preparing his staff and his stash of personal protective equipment to protect his team from flu outbreaks.
In the back of the ambulance, we're in real close proximity to the patients that we care for. And so I wrote a flu pandemic response plan, and I did that in December. And so we actually had a large supply of N95 masks. We had about 19,000 of them at the beginning of the pandemic.
As it became clear the virus would make its way to the United States, Moody was again ahead of the curve, ordering Tyvek suits, goggles, and more N95 masks. And as soon as he saw the first case in Texas, he had his staff wearing their mask on every call. However, in some cases, even all the protective gear was not enough to keep the paramedics safe.
We did have 2 cases where people become infected from calls. Both were from the same thing. It was before we got the face shields, and COVID had a real problem with projectile vomiting. And so they actually both got projectile vomited in their face, and so that overcome all their protective gear. That's what COVID's not a pleasant thing to catch. Some people have very minor symptoms and other people have very severe symptoms.
Wearing the extra equipment and the additional workload, as each day averaged the 5 to 7 additional ambulance calls per day, was exhausting.
People, when they decide to go to the hospital with COVID, they're sick. They're really sick. And so we've had numerous COVID cardiac arrests, which really is a mental strain, because that person has a very high dose of the virus in their body. And so doing the compressions and everything in the back of the closed space, it's a very infectious atmosphere.
At the hospital, the care teams in the units devoted to COVID patients working 12-hour shifts to care for patients who could not have visitors. No friends, no family.
The one thing I would tell the public is that we do care about their mom and their dad, even though they can't come see them in the hospital. That we're giving them 100%. We're talking to them, we're turning them, we're singing to them, staying in the room with them, holding their hand, that we do care and that we are taking care of them. And I know they can't be there, and that's hard. It is so hard. But I promise that the staff is taking care of them.
I hope that they understand that we really have done our due diligence to do the very best we can, provide the best care that we can for their family, especially those that lost loved ones. I hope that they understand that we didn't just give up on them, that we did the best we could every day.
Continually changing protective gear, caring for patients, and keeping their spirits up despite not being able to see their loved ones has been challenging.
Our team has stepped up, and for the most part, everyone has been extremely positive. Yes, we get run down, but then someone cracks a joke, makes us all laugh, and we just keep going.
Our Angelina County community is beyond grateful for every healthcare person who every day goes to work and cares for those suffering with this virus.
I feel like we've had the support of the community. They've been out, they've put out signs, they've been out and had prayer where they've turned their vehicles on with the lights on, and people have stood at the windows and waved, and it just means a lot. It does.
They definitely feel appreciated. As I talk to them, their morale is high, and they know that the communities appreciate what they've done for them.
Now, more than a year later, the virus is still here, and our dedicated healthcare workers continue to accept the challenge and tackle what has become the most difficult and unpredictable virus they have encountered.
Thank you for recognizing the angels and the staff that are taking care of the patients. It's all about them, and it's all about teamwork, and how much we appreciate their support. And having the support of your community it means the world.